Hi everyone, this is Nurse Hannah from nursestudy.net. I've lost my voice again, so I'll make this quick. We have sepsis, 50 questions with answers and rationales. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 65-year-old male presents to the emergency department with suspected sepsis. His vital signs are temperature 39.2 degrees Celsius, heart rate 122, blood pressure 82/48, respiration rate 24. The nurse anticipates which healthcare provider orders should be implemented first. A. Obtain blood cultures and begin broad-spectrum antibiotics. B. Start norepinephrine infusion. C. Begin 30 milliliters per kilogram crystalloid bolus. D. Insert a central venous catheter. Correct answer, C. Rationale: in sepsis management, the first priority is fluid resuscitation with 30 milliliters per kilogram of crystalloid within the first 3 hours. While blood cultures and antibiotics are crucial, option A, they follow initial fluid resuscitation. Norepinephrine, option B, is indicated if hypotension persists after fluid resuscitation. Central line placement, option D, may be necessary, but isn't the first priority. Question 2. During a sepsis code, the nurse is caring for a patient who has received 2 liters of normal saline. The patient's MAP remains at 58 millimeters of mercury. Which finding would indicate the need for immediate vasopressor therapy? A. Serum lactate of 2.1 millimoles per liter. B. Urine output of 30 milliliters per hour. C. Central venous pressure of 12 millimeters of mercury. D. SCVO2 of 65%. Correct answer, A. Rationale: according to sepsis guidelines, vasopressors should be initiated when mean arterial pressure, MAP, remains less than 65 millimeters of mercury despite adequate fluid resuscitation. The elevated lactate, greater than 2 millimoles per liter, with persistent hypotension indicates tissue hypoperfusion requiring immediate vasopressor support. The other values, options B, C, and D, are within acceptable ranges and wouldn't independently trigger vasopressor initiation. Question 3. A nurse is assessing a patient with gram-negative sepsis who has been receiving norepinephrine for 12 hours. Which finding requires immediate notification of the healthcare provider? A. Mottled skin appearance on extremities. B. Peripheral capillary refill of 3 seconds. C. Diminished pedal pulses bilaterally. D. Cool temperature of fingers and toes. Correct answer, A. Rationale: mottled skin appearance, particularly in a patient receiving vasopressors, indicates severe tissue hypoperfusion and potential progression of shock requiring immediate intervention. Mottling suggests microvascular dysfunction and can be an early warning sign of deteriorating tissue perfusion, even when macrohemodynamic parameters appear stable. Other findings such as peripheral capillary refill of 3 seconds, B, diminished pedal pulses, C, and cool extremities. D, can be expected findings in patients receiving vasopressors due to alpha-adrenergic peripheral vasoconstriction. However, mottling specifically suggests inadequate tissue oxygenation at the microvascular level and has been associated with increased mortality in septic shock. Question 4. A nurse is caring for a patient with sepsis who has developed acute kidney injury. The patient's latest lab values show BUN 45 mg per deciliter, creatinine 2.8 mg per deciliter, potassium 6.2 milliequivalent per liter, pH 7.28. Which early sign should the nurse monitor that could indicate worsening hyperkalemia? A. Changes in level of consciousness. B. Altered T waves on cardiac monitor. C. Decreased respiratory rate. D. Bilateral pedal edema. Correct answer, B. Rationale: early signs of hyperkalemia are best detected on ECG monitoring, with tall, peaked T waves being one of the earliest indicators. This occurs before the more serious complications like QRS widening or cardiac arrest. Changes in consciousness, A, are late signs. Respiratory changes, C, are not typically associated with hyperkalemia, and edema, D, is unrelated to hyperkalemia. Question 5. A patient with septic shock has been receiving norepinephrine at 12 micrograms per minute for 4 hours. Despite this intervention, their MAP remains at 58 millimeters of mercury. Which additional medication should the nurse anticipate being ordered? A. Dopamine. B. Vasopressin. C. Phenylephrine. D. Epinephrine. Correct answer, B. Rationale: vasopressin is typically added as a second-line vasopressor when norepinephrine alone fails to achieve target MAP greater than or equal to 65 millimeters of mercury. Unlike other options, vasopressin works through a different mechanism, V1 receptors, and can help reduce norepinephrine requirements. Dopamine, A, is no longer recommended as first-line therapy. Phenylephrine, C, is generally reserved for specific situations, and epinephrine, D, is typically used as an alternative to norepinephrine, not as an addition. Question 6. A nurse is performing a sepsis screening on a patient with suspected pneumonia. Which combination of findings would meet the criteria for sepsis according to the QSOFA score? A. Temperature 38.5 degrees Celsius, WBC 15,000, heart rate 98. B. Respirations of 24, altered mentation, blood pressure of 100/60. C. Lactate 1.8 millimoles per liter, platelets 140,000, heart rate 110. D. Creatinine 1.8 milligrams per deciliter, bilirubin 2.0 milligrams per deciliter, temperature 38.2 degrees Celsius. Correct answer, B. Rationale: the quick SOFA, QSOFA, score includes 3 criteria: respiratory rate greater than or equal to 22 per minute, altered mental status, and systolic blood pressure less than or equal to 100 millimeters of mercury. Option B is the only combination that includes 2 QSOFA criteria: elevated respiratory rate and altered mentation. The other options include various abnormal findings, but don't meet specific QSOFA criteria. Question 7. A nurse is caring for a patient with septic shock who has been receiving broad-spectrum antibiotics for 48 hours. The patient's blood pressure has normalized, but their temperature remains elevated at 38.9 degrees Celsius. Which assessment finding would be most concerning? A. New onset of productive cough. B. Persistent tachycardia. C. Decreased oxygen requirements. D. Improved mental status. Correct answer, A. Rationale: a new onset of productive cough after 48 hours of appropriate antibiotic therapy could indicate a secondary infection or antibiotic resistance, requiring immediate medical attention. Persistent tachycardia, B, can be expected during recovery, while decreased oxygen requirements, C, and improved mental status, D, are positive signs of improvement. Question 8. A nurse is caring for 4 patients. Which patient should the nurse assess first based on the highest risk for developing sepsis? A. 45-year-old with type 2 diabetes and a small foot ulcer. B. 72-year-old receiving chemotherapy with a portacath. C. 35-year-old post-appendectomy day 2 with mild incisional pain. D. 60-year-old with COPD using home oxygen. Correct answer, B. Rationale: the 72-year-old chemotherapy patient with a central line is at highest risk for sepsis due to multiple risk factors: advanced age, immunosuppression from chemotherapy, and presence of an invasive device. While the other patients have risk factors, diabetes, surgery, chronic illness, the combination of factors in option B creates the highest risk scenario. Question 9. A nurse is implementing sepsis bundle interventions for a newly admitted patient. Which intervention should the nurse question if ordered within the first hour of presentation? A. Administration of cefepime 2 grams IV. B. Placement of an arterial line. C. Collection of blood cultures. D. Fluid challenge with 30 milliliters per kilogram NS. Correct answer, B. Rationale: while arterial line placement may be necessary for ongoing management of septic shock, it should not delay the implementation of time-sensitive bundle elements in the first hour: fluid resuscitation, blood cultures, antibiotics. The other interventions, A, C, D, are all appropriate and time-critical components of the initial sepsis bundle. Question 10. A nurse is caring for a patient in septic shock who has received appropriate fluid resuscitation and vasopressors. The patient's arterial blood gas shows pH 7.28, PaCO2 32 mm of mercury, HCO3 15 milliequivalent per liter, PaO2 88 mm of mercury. Which compensatory mechanism is primarily demonstrated? A. Respiratory alkalosis. B. Metabolic acidosis with respiratory compensation. C. Respiratory acidosis with metabolic compensation. D. Mixed metabolic and respiratory acidosis. Correct answer, B. Rationale: the blood gas values show a primary metabolic acidosis low HCO3 with respiratory compensation low PaCO2. This is a common finding in septic shock due to lactic acidosis from tissue hypoperfusion. The body compensates by increasing ventilation to lower PaCO2. The other options do not correctly interpret the relationship between the primary disorder and compensatory mechanism. Question 11. A nurse is caring for a patient with septic shock who develops acute respiratory distress syndrome, ARDS. The healthcare provider has ordered prone positioning. Which finding would contraindicate this intervention? A. BMI of 40. B. Presence of bilateral chest tubes. C. Recent abdominal surgery with open wound. D. Continuous renal replacement therapy. Correct answer, C. Rationale: an open abdominal wound from recent surgery is an absolute contraindication to prone positioning. While obesity, A, chest tubes, B, and CRRT, D, make prone positioning more challenging, they are not absolute contraindications when proper precautions are taken. Question 12. A nurse is monitoring a patient with sepsis who has developed disseminated intravascular coagulation, DIC. Which combination of laboratory values would most strongly indicate worsening DIC? A. PT 15 seconds, fibrinogen 200 mg per deciliter, D-dimer 1000 nanograms per milliliter. B. PT 18 seconds, platelets 80,000, fibrinogen 400 mg per deciliter. C. Platelets 50,000, fibrinogen 100 mg per deciliter, D-dimer 4000 nanograms per milliliter. D. D-dimer 2000 nanograms per milliliter, platelets 100,000, PT 14 seconds. Correct answer, C. Rationale: the combination in option C shows the most concerning pattern for worsening DIC, significant thrombocytopenia, low fibrinogen consumption, and markedly elevated D-dimer. This pattern indicates both increased coagulation and consumption of clotting factors. The other options show less severe or incomplete patterns of coagulation disturbance. Question 13. A nurse is caring for a patient with septic shock who has developed acute kidney injury. The patient's urine output has been less than 0.3 milliliters per kilogram per hour for the past 8 hours, despite fluid resuscitation. Which assessment finding requires immediate healthcare provider notification? A. Respiratory rate of 24 breaths per minute. B. Serum potassium of 6.8 milliequivalent per liter. C. Blood glucose of 180 mg per deciliter. D. Creatinine increase from 1.8 to 2.2 mg per deciliter. Correct answer, B. Rationale: a serum potassium level of 6.8 milliequivalent per liter represents severe hyperkalemia that requires immediate intervention due to the risk of cardiac arrhythmias. While the other findings are abnormal, they don't represent immediate life-threatening conditions requiring emergency intervention. Question 14. A nurse is reviewing the medication list for a patient with sepsis secondary to pneumonia. Which combination of medications requires closest monitoring for potential adverse interaction? A. Vancomycin and norepinephrine. B. Piperacillin-tazobactam and furosemide. C. Vancomycin and piperacillin-tazobactam. D. Norepinephrine and methylprednisolone. Correct answer, C. Rationale: The combination of vancomycin and piperacillin tazobactam has been associated with an increased risk of acute kidney injury compared to either agent alone. This combination requires careful monitoring of renal function and drug levels. The other combinations, while requiring normal monitoring, don't have this specific documented interaction risk. Question 15. A patient with septic shock has been receiving norepinephrine for 24 hours. The nurse notes progressive darkening of the fingers and toes bilaterally. Which intervention should the nurse anticipate? A. Discontinuation of norepinephrine. B. Addition of dobutamine. C. Switch to phenylephrine. D. Initiation of vasopressin to reduce norepinephrine requirements. Correct answer, D. Rationale: adding vasopressin can help reduce norepinephrine requirements while maintaining adequate perfusion, potentially reducing peripheral ischemia. Simply discontinuing norepinephrine, A, could cause hemodynamic collapse, dobutamine, B, wouldn't address the peripheral ischemia, and switching to phenylephrine, C, wouldn't improve the situation as it's also a pure vasoconstrictor. Question 16. A nurse is caring for a neutropenic patient who develops sepsis. Which finding should prompt the most immediate intervention? A. Temperature of 38.3 degrees Celsius. B. Single blood pressure reading of 100 over 60 millimeters of mercury. C. Heart rate increase from 88 to 100 beats per minute. D. New onset rigors with temperature 37.8 degrees Celsius. Correct answer, D. Rationale: in neutropenic patients, rigors, even with a relatively normal temperature, indicate serious infection requiring immediate intervention. Neutropenic patients may not mount the same inflammatory response as non-neutropenic patients, making any sign of infection more significant. While the other options show changes, they are less concerning in isolation. Question 17. A nurse is implementing a sepsis protocol for a patient with severe sepsis. Initial labs show pH 7.15, lactate 6.5 millimoles per liter, SCVO2 55%. After fluid resuscitation and norepinephrine initiation, which parameter best indicates adequate oxygen delivery? A. Central venous pressure. B. Mixed venous oxygen saturation. C. Mean arterial pressure. D. Arterial blood gases. Correct answer, B. Rationale: mixed venous oxygen saturation, SVO2, or central venous oxygen saturation, SCVO2, is the best indicator of the balance between oxygen delivery and consumption. While all parameters provide valuable information, SCVO2 and SVO2 specifically reflects tissue-level oxygen utilization and adequacy of cardiac output. Normal SCVO2, greater than 70%, indicates adequate oxygen delivery relative to consumption. Question 18. A nurse is assessing a patient with septic shock who develops acute liver dysfunction. Which combination of findings indicates hepatorenal syndrome? A. AST 450, ALT 380, creatinine 1.5 mg per deciliter. B. Total bilirubin 3.5 mg per deciliter, BUN 45 mg per deciliter, creatinine 1.8 mg per deciliter. C. Creatinine 2.5 mg per deciliter, oliguria, normal renal ultrasound. D. Direct bilirubin 2.0 mg per deciliter, proteinuria, hypertension. Correct answer, C. Rationale: hepatorenal syndrome is characterized by acute kidney injury, elevated creatinine, oliguria, in the setting of liver dysfunction, with normal renal ultrasound findings, indicating no structural kidney disease. The other options show various abnormalities but don't specifically indicate hepatorenal syndrome. Question 19. A nurse is caring for a septic patient who requires mechanical ventilation. The patient's PaO2 and FiO2 ratio is 150, and they're receiving lung-protective ventilation. Which parameter should the nurse monitor most closely? A. End-tidal CO2. B. Plateau pressure. C. Auto-PEEP. D. Respiratory rate. Correct answer, B. Rationale: in patients with ARDS secondary to sepsis, plateau pressure must be kept less than or equal to 30 to prevent ventilator-induced lung injury. While all parameters are important, plateau pressure is the most critical for preventing further lung injury in the setting of protective ventilation. Question 20. A nurse is preparing to administer a vasopressor to a septic patient through a peripheral IV. Which intervention is most important to prevent complications? A. Use the largest available peripheral catheter. B. Rotate the IV site every 12 hours. C. Monitor for infiltration every hour. D. Place the IV in the antecubital fossa. Correct answer, C. Rationale: when vasopressors must be administered peripherally, frequent monitoring for infiltration, at least hourly, is crucial to prevent tissue necrosis. While catheter size, A, and site rotation, B, are important, hourly monitoring is most critical. The antecubital fossa, D, is not an ideal site due to the risk of complications if infiltration occurs. Question 21. A pregnant patient at 32 weeks gestation presents with sepsis due to pyelonephritis. Which finding would be considered normal for this patient but concerning in a non-pregnant patient? A. Heart rate of 110 beats per minute. B. Respiratory rate of 24 breaths per minute. C. White blood cell count of 14,000. D. Blood pressure of 90/60 mm of mercury. Correct answer, C. Rationale: a WBC count of 14,000 is normal during pregnancy due to physiologic leukocytosis, but would be concerning in non-pregnant patients. The other vital sign changes, A, B, D, would be equally concerning in pregnant and non-pregnant patients with sepsis. Question 22. A nurse is caring for a pediatric patient with septic shock who has received 60 milliliters per kilogram of fluid resuscitation but remains hypotensive. Which finding indicates the need for immediate initiation of vasopressor support? A. Capillary refill time of 4 seconds. B. Heart rate of 165 beats per minute. C. Cold extremities with weak pulses. D. Altered mental status with decreased responsiveness. Correct answer, D. Rationale: altered mental status with decreased responsiveness in a fluid-refractory pediatric septic shock patient indicates severe end organ dysfunction requiring immediate vasopressor support. While the other signs, A, B, C, are concerning, altered mental status represents the most severe indication of inadequate tissue perfusion. Question 23. A nurse is monitoring a septic patient receiving empiric antibiotics. The microbiology lab reports gram-positive cocci in clusters from blood cultures. Which change in antibiotic therapy should the nurse anticipate? A. Addition of ceftriaxone. B. Initiation of vancomycin. C. Discontinuation of piperacillin-tazobactam. D. Addition of metronidazole. Correct answer, B. Rationale: gram-positive cocci in clusters typically suggest Staphylococcus species, which requires coverage with vancomycin until susceptibilities are known, particularly given the prevalence of methicillin-resistant strains. The other options don't provide appropriate coverage for this likely pathogen. Question 24. An immunocompromised patient with sepsis develops acute adrenal insufficiency. Which combination of findings would most strongly indicate this complication? A. Hyponatremia, hyperkalemia, hypotension refractory to fluids. B. Hypernatremia, hypokalemia, tachycardia. C. Hypoglycemia, metabolic acidosis, hypertension. D. Hyperglycemia, respiratory alkalosis, normal blood pressure. Correct answer, A. Rationale: the classic triad of adrenal insufficiency includes hyponatremia, hyperkalemia, and hypotension that is refractory to fluid resuscitation. This is particularly concerning in immunocompromised patients who may have been on chronic steroids. The other combinations don't represent typical adrenal insufficiency patterns. Question 25. A nurse is caring for a septic patient who develops delirium. Which intervention should be implemented first? A. Apply physical restraints. B. Administer scheduled antipsychotics. C. Implement environmental modifications. D. Request a psychiatric consultation. Correct answer, C. Rationale: environmental modifications, maintaining day-night cycles, minimizing interruptions, promoting orientation, should be the first intervention for sepsis-associated delirium. Physical restraints, A, may worsen delirium, antipsychotics, B, should not be the first-line treatment, and psychiatric consultation, D, is not the initial step. Question 26. A nurse is caring for an elderly patient with sepsis who develops acute encephalopathy. Which intervention would be most appropriate to assess the patient's cognitive status? A. Montreal Cognitive Assessment, MOCA. B. Confusion Assessment Method for ICU, CAM-ICU. C. Mini Mental State Examination, MMSE. D. Glasgow Coma Scale, GCS. Correct answer, B. Rationale: the CAM-ICU is specifically designed and validated for assessing delirium in critically ill patients, including those with sepsis. While other tools, A, C, D, can assess cognitive function or consciousness, they are either too complex for critically ill patients or don't specifically assess delirium in the ICU setting. Question 27. A nurse is monitoring coagulation parameters in a septic patient. Which combination of findings most strongly suggests compensated DIC? A. Platelets 90,000, PT 16 seconds, fibrinogen 400 mg per deciliter. B. D-dimer 2,500 nanograms per milliliter, platelets 140,000, normal PT. C. Fibrinogen 150 mg per deciliter, D-dimer 3,000 nanograms per milliliter, platelets 120,000. DPT 14 seconds, platelets 80,000, D-dimer normal. Correct answer, C. Rationale: compensated DIC typically shows moderate changes in multiple coagulation parameters, moderately low fibrinogen, elevated D-dimer, mild thrombocytopenia, without severe derangement of any single value. The other combinations either show isolated abnormalities or don't reflect the pattern typical of compensated DIC. Question 28. A postoperative patient develops sepsis 48 hours after abdominal surgery. Which finding should prompt immediate return to the operating room? A. New onset atrial fibrillation. B. Rising serum lactate despite antibiotics. C. Increasing vasopressor requirements. D. Rigid abdomen with severe pain. Correct answer, D. Rationale: a rigid abdomen with severe pain in a postoperative patient with sepsis suggests possible anastomotic leak or intra-abdominal catastrophe requiring immediate surgical exploration. While the other findings, A, B, C, are concerning, they don't specifically indicate the need for immediate surgical intervention. Question 29. A nurse is assessing tissue perfusion in a septic patient. Which parameter most accurately reflects microvascular perfusion? A. Central venous pressure. B. Mean arterial pressure. C. Sublingual microcirculation. D. Mixed venous oxygen saturation. Correct answer, C. Rationale: sublingual microcirculation assessment provides direct visualization of microvascular blood flow and is the most accurate reflection of tissue-level perfusion. The other parameters, A, B, D, are indirect measures of perfusion and may not accurately reflect microvascular function, particularly in sepsis where microcirculatory dysfunction can persist despite normal macrohemodynamic parameters. Question 30. A nurse is caring for a septic patient who develops acute cholestasis. Which medication requires immediate dosing adjustment? A. Norepinephrine. B. Vancomycin. C. Fentanyl. D. Cefepime. Correct answer, C. Rationale: fentanyl, being highly lipophilic and hepatically metabolized, requires immediate dose adjustment in cholestasis to prevent drug accumulation and oversedation. While other medications may need eventual adjustment, fentanyl's properties make it most susceptible to accumulation in acute liver dysfunction. Question 31. A nurse is monitoring a patient with septic shock who develops acute right ventricular dysfunction. Which combination of interventions should the nurse anticipate? A. Increase PEP, add dobutamine, maintain euvolemia. B. Decrease PEP, add epinephrine, minimize fluid administration. C. Maintain low PEP, add milrinone, ensure adequate preload. D. Increase PEP, add vasopressin, aggressive fluid resuscitation. Correct answer, C. Rationale: in right ventricular dysfunction, maintaining low PEP helps reduce RV afterload. Milrinone provides inotropic support with pulmonary vasodilation, and adequate preload is essential for RV function. The other combinations could worsen RV function through increased afterload, A, D, or inadequate preload, B. Question 32. A nurse is caring for a septic patient receiving mechanical ventilation. The patient's PaO2 and FiO2 ratio is 80, and they're requiring FiO2 1.0. Which advanced ventilation strategy should the nurse prepare to implement? A. High-frequency oscillatory ventilation. B. Airway pressure release ventilation. C. Prone positioning with neuromuscular blockade. D. Extracorporeal membrane oxygenation evaluation. Correct answer, C. Rationale: in right ventricular dysfunction, maintaining low PEP helps reduce RV afterload. Milrinone provides inotropic support with pulmonary vasodilation, and adequate preload is essential for RV function. The other combinations could worsen RV function through increased afterload, A, D, or inadequate preload, B. Question 32. A nurse is caring for a septic patient receiving mechanical ventilation. The patient's PaO2 and FiO2 ratio is 80, and they're requiring FiO2 1.0. Which advanced ventilation strategy should the nurse prepare to implement? A. High-frequency oscillatory ventilation. B. Airway pressure release ventilation. C. Prone positioning with neuromuscular blockade. D. Extracorporeal membrane oxygenation evaluation. Correct answer, D. Rationale: with severe hypoxemia, PF ratio less than 100, despite optimal conventional management and prone positioning, ECMO evaluation is indicated. The other options, A, B, C, are intermediate steps that should have already been attempted before considering ECMO in severe ARDS. Question 33. A 65-year-old male patient presents with fever, tachycardia, and confusion. Blood pressure is 85/50 mm of mercury, and lactate levels are elevated at 4 millimoles per liter. What is the nurse's priority intervention? A. Administer antipyretics for fever. B. Initiate 0.9% normal saline bolus. C. Obtain blood cultures before starting antibiotics. D. Monitor urine output hourly. Correct answer, C. Rationale: blood cultures should be obtained before administering antibiotics to identify the causative organism. While fluid resuscitation, option B, and monitoring urine output, option D, are critical steps, obtaining blood cultures is a priority to guide antibiotic therapy. Question 34. A patient in the ICU is diagnosed with sepsis secondary to pneumonia. The patient develops oliguria and anuria despite aggressive fluid resuscitation. Which complication of sepsis is the patient most likely experiencing? A. Disseminated intravascular coagulation, DIC. B. Acute kidney injury, AKI. C. Acute respiratory distress syndrome, ARDS. D. Multiple organ dysfunction syndrome, MODS. Correct answer, B. Rationale: oliguria and anuria indicate acute kidney injury, AKI, a common complication of sepsis caused by hypoperfusion and renal ischemia. ARDS, option C, typically presents with respiratory distress, and MODS, option D, is a more systemic progression. Question 35. The nurse is caring for a patient with sepsis who has a mean arterial pressure, MEP, of 55 mm of mercury after initial fluid resuscitation. Which medication does the nurse anticipate will be ordered? A. Vasopressin. B. Dopamine. C. Norepinephrine. D. Dobutamine. Correct answer, C. Rationale: norepinephrine is the first-line vasopressor used to increase MAP in patients with septic shock unresponsive to fluids. Vasopressin, option A, may be added later as an adjunct, while dopamine and dobutamine have specific indications. Question 36. Which lab result most strongly indicates the presence of sepsis in a patient? A. White blood cell count of 5,000. B. Procalcitonin level of 12 nanograms per milliliter. C. Serum lactate of 1 millimole per liter. D. Hemoglobin of 10. Correct answer, B. Rationale: a procalcitonin level greater than 2 nanograms per milliliter strongly suggests sepsis due to bacterial infection. Elevated serum lactate, greater than 2 millimoles per liter, would also support the diagnosis, but is not as specific. Question 37. A nurse is assessing a patient diagnosed with sepsis. The patient has warm, flushed skin, a temperature of 38.5 degrees Celsius 101.3 degrees Fahrenheit, and a heart rate of 115 beats per minute. What stage of sepsis does this most likely indicate? A. Early sepsis. B. Septic shock. C. Severe sepsis. D. MODS. Correct answer, A. Rationale: warm, flushed skin and elevated temperature with tachycardia indicate early sepsis. As sepsis progresses, patients may develop hypotension, organ dysfunction, and cold, clammy skin. Question 38. A 48-year-old female with a history of diabetes presents with a urinary tract infection, UTI. She reports chills, weakness, and abdominal pain. Vital signs: blood pressure 90/55 millimeters of mercury, heart rate 120 beats per minute, temp 39 degrees Celsius 102.2 degrees Fahrenheit. What is the most appropriate next step? A. Administer acetaminophen for fever. B. Initiate broad-spectrum antibiotics. C. Perform a urinalysis. D. Insert an indwelling catheter. Correct answer, B. Rationale: broad-spectrum antibiotics should be initiated promptly after cultures are obtained to treat the underlying infection causing sepsis. Fever management and urinalysis are supportive measures but are not the immediate priority. Question 39. The nurse is caring for a patient with sepsis receiving IV antibiotics and fluid resuscitation. Which finding requires immediate intervention? A. Blood glucose of 150 mg per deciliter. B. Urine output of 20 milliliters per hour. C. Respiratory rate of 22 breaths per minute. D. Serum lactate of 2.5 millimoles per liter. Correct answer, B. Rationale: oliguria, less than 30 milliliters per hour, suggests inadequate perfusion and may indicate worsening organ dysfunction. Elevated respiratory rate and lactate require monitoring but are less immediately concerning. Question 40. A patient with sepsis develops petechiae and ecchymosis. Laboratory results show prolonged PT-INR and a decreased platelet count. Which complication should the nurse suspect? A. ARDS. B. DIC. C. MODS. D. AKI. Correct answer, B. Rationale: disseminated intravascular coagulation, DIC, is characterized by clotting abnormalities, including prolonged PT-INR and thrombocytopenia, leading to petechiae and ecchymosis. Question 41. A patient with sepsis has been receiving norepinephrine for 2 hours. The MAP is now 70 millimeters of mercury. What is the nurse's next priority? A. Discontinue norepinephrine. B. Reassess fluid balance and output. C. Increase the norepinephrine dose. D. Administer a corticosteroid. Correct answer, B. Rationale: once MAP stabilizes, the nurse should reassess the patient's fluid status and perfusion. Discontinuing norepinephrine or adjusting the dose without reassessment could destabilize the patient. Question 42. A nurse is educating a family about sepsis prevention. Which recommendation is most effective? A. Use over-the-counter antibiotics for minor infections. B. Delay vaccinations until after illness recovery. C. Perform regular hand hygiene. D. Limit fluid intake during fever. Correct answer, C. Rationale: hand hygiene is the most effective method for preventing infections that can lead to sepsis. Over-the-counter antibiotics are not appropriate, and delaying vaccinations may increase infection risk. Question 43. A patient with sepsis is receiving IV fluids. Despite adequate resuscitation, their blood pressure remains low, and they are started on norepinephrine. What parameter is most critical for the nurse to monitor during norepinephrine infusion? A. Heart rate. B. Peripheral perfusion. C. Blood pressure. D. Central venous pressure, CVP. Correct answer, C. Rationale: blood pressure is the most critical parameter to monitor during norepinephrine infusion to ensure adequate perfusion. Peripheral perfusion, option B, is also important but secondary to maintaining adequate blood pressure. Question 44. A patient with sepsis is exhibiting restlessness, agitation, and confusion. Which intervention should the nurse prioritize? A. Check arterial blood gases. B. Increase the oxygen flow rate. C. Administer a sedative. D. Assess for hypoxia or hypoperfusion. Correct answer, D. Rationale: restlessness, agitation, and confusion may indicate hypoxia or hypoperfusion. The nurse should assess and address these underlying causes before considering sedatives or increasing oxygen flow. Question 45. A 78-year-old female patient is admitted to the ICU with suspected sepsis. She has a history of diabetes and chronic obstructive pulmonary disease, COPD. Her current vitals are blood pressure 85/55 mm of mercury, pulse 125, respirations 28 per minute, and SpO2 89% on room air. Her lactate level is 5 millimoles per liter. What is the nurse's priority intervention? A. Administer 2 liters of oxygen via duct nasal cannula. B. Administer a 30 milliliters per kilogram bolus of 0.9% normal saline. C. Start norepinephrine infusion to stabilize blood pressure. D. Draw arterial blood gases, ABG. Correct answer, B. Rationale: fluid resuscitation with a 30 milliliters per kilogram bolus is the priority in a patient with septic shock to improve tissue perfusion. Oxygen supplementation, A, and drawing ABGs, D, are supportive measures but not the immediate priority. Norepinephrine, C, is considered if fluid resuscitation is insufficient. Question 46. A patient diagnosed with sepsis is started on broad-spectrum antibiotics after blood cultures were drawn. Despite this, the patient's blood pressure remains low at 90/60 mm of mercury, and urine output is 10 milliliters per hour. Which intervention should the nurse anticipate? A. Administer a loop diuretic to improve urine output. B. Begin vasopressor therapy with norepinephrine. C. Increase the infusion rate of maintenance IV fluids. D. Administer corticosteroids to address adrenal insufficiency. Correct answer, B. Rationale: vasopressors, such as norepinephrine, are indicated for septic shock when blood pressure does not improve with adequate fluid resuscitation. Diuretics, A, are contraindicated in hypoperfusion. Increasing maintenance fluids, C, is less effective in this scenario. Corticosteroids, D, may be considered for refractory shock but are not the immediate next step. Question 47. A 45-year-old male presents with fever, tachycardia, hypotension, and confusion. Blood cultures are positive for gram-negative bacilli. Which assessment finding indicates the patient is progressing to multiple organ dysfunction syndrome, MODS? A. Creatinine 1 mg per deciliter and urine output 50 milliliters per hour. B. Bilirubin 3.5 mg per deciliter and new onset jaundice. C. Platelet count 200,000 with normal coagulation studies. D. Heart rate 90 beats per minute with no arrhythmias. Correct answer, B. Rationale: elevated bilirubin and jaundice indicate liver dysfunction, a hallmark of MODS. Creatinine, A, and platelets, C, are within normal limits. Heart rate, D, is also normal and does not suggest progression to MODS. Question 48. A patient with sepsis develops disseminated intravascular coagulation, DIC. Lab results show prolonged PT-INR, elevated D-dimer, and decreased fibrinogen levels. What is the nurse's priority intervention? A. Administer fresh frozen plasma, FFP, as prescribed. B. Start an infusion of heparin to prevent microthrombi formation. C. Monitor vital signs and assess for bleeding. D. Prepare the patient for an emergent splenectomy. Correct answer, A. Rationale: fresh frozen plasma replaces clotting factors and is the priority intervention in a patient with DIC and active bleeding. Heparin, B, may be used for clot prevention but is not prioritized in bleeding. Monitoring, C, is supportive but not therapeutic. Splenectomy, D, is not indicated for DIC. Question 49. A 62-year-old female patient with a history of chemotherapy presents with fever, chills, and hypotension. The nurse observes petechiae on her extremities. Labs reveal WBC 2000, platelets 50,000, and hemoglobin 8. What action should the nurse take first? A. Administer IV antibiotics within 1 hour. B. Initiate a platelet transfusion. C. Isolate the patient to prevent infection. D. Administer erythropoietin to address anemia. Correct answer, A. Rationale: administering IV antibiotics within 1 hour is critical in treating neutropenic sepsis to prevent rapid deterioration. Platelet transfusion, B, and erythropoietin, D, may be considered later, based on clinical needs. Isolation, C, is important but secondary to antibiotic administration. Question 50. A 48-year-old female patient presents to the ED with fever, confusion, and abdominal pain. CT imaging confirms a perforated bowel, and her WBC is 22,000. What is the most appropriate immediate action? A. Administer IV antibiotics. B. Prepare the patient for emergency surgery. C. Insert a nasogastric tube for decompression. D. Initiate an infusion of vasopressors. Correct answer, A. Rationale: immediate administration of IV antibiotics is critical in managing sepsis caused by a perforated bowel. Surgery, B, is likely necessary but not the first step. NG tube insertion, C, and vasopressors, D, are supportive measures but do not address the source of infection directly.